So, like I said, I've never worked on Andrea before, and what we're going to do as a, come on over here, as a professional massage therapist, what we're doing, we try to find out what's the cause, the issue, and we do postural assessment. We want to find out why it's the person is continue get that pain, because you always come back to this massage places with the same problem, and they not doing what they're supposed to do. Yeah, you see, it's kind of
the joint begins like at the edge of the scapula. Here on the right side, moving into my arm. I'm a therapist myself, so of course I'm using.
We're gonna focus on that shoulder today. Why it's a pain in that shoulder, and the right one, right? Okay, so right shoulder pain. Is any particular movements you feel that pain?
I don't really feel it when I'm moving. I normally feel it when I'm just relaxing.
So
it's like one little spot.
So when Andrea relaxes, she feel that pain. And tell me, is that shooting down?
No, it doesn't.
So it's just
shoot.
a local.
It's right here locally.
Okay, all right. So what we're looking for, Andrea, right now, we're going to look at that postural assessment, and we go into our first mission. Is look at. I just placed that 2 fingers right here, and what I'm see here, I see that right shoulder is higher. Correct?
They look so close.
Close, but that's fine. Yeah. But also what I'm looking for that front rotation. That's mean that dominate muscle, that PAX, is being rotate that whole humeral bone inside. So this is what's happening. You see how the arms is. Here we go. She's already know. So let's place this arm up here. The simple test, you're going to drive that elbow up as far as possible. If you have pain, let me know. No pain at all?
No pain at all. I feel sensation.
Okay.
But I don't.
The thumbs up right in here, hold. It's called bottoms up, and we're going to push, resist it. Is any pain?
No.
Good. Now we're going to bring it back, and this is, she pulled towards herself. I'm trying to pull away from her body. Go ahead and pull towards yourself. Is any pain?
No.
Okay. So I don't see any painful test. It could be something else. So what we're doing now, we're going to test it.
I feel it here.
You feel it in here? Yes. So
it's
she feels
connected to that.
Of course.
That
so
group of muscles that are.
All right. So let's turn around. Let's turn around, and I want you to squeeze your thumb like this, and drive around your head, and try to do this way.
Like that?
Yeah, like that, as far as possible. So here we go. You see this? Only slightly, and I'm asking you to raise this up as far as possible. Any pain?
Nope.
Okay, let it go. And now backward. That's it. So we don't have internal rotation of the shoulder. Let me, extension of the shoulder, of course. Go ahead, raise this shoulder up. Not the shoulder, arm, sorry. Here we go. And I try to help, don't worry. Every time you feel that restrictions, you don't crank it more. So that's why maybe she's like, it's terrible work on massage therapists, because they
your knees a little bit and pull your energy back a tiny bit. It would feel better.
You've got too much sound there.
I've got too much energy, yeah. So, but yes, what I'm also feel, if we check that fascia, it's not moving down. You see, it's like it's stuck, it's jammed up here. When you pull up, it's perfectly go up. It's not going to the left, to the right, her right, and it's not, going down. So what we can do, truly work on that fascia to move, and slightly. I probably can spend only 20 minutes just move that fascia. And you see, I don't use any oil. She said it's pressure was 5 pounds is already was too much, so I switched to 2 pounds.
I'm one of those I can't handle a lot of pressure this way, but I can handle more another way. You can.
I'm just
do whatever you want. I'll let you know if it hurts.
So yeah, it's kind of.
It feels really like you're right at where it's tightening up, where I feel it.
Yeah, so this is most of the time, this is infraspinatus muscle, and sometimes it's radiate in the front of your shoulder. If you can see that trigger point map Oh, ligaments pain, that's what it is. Like I said, it's several muscles who can be affected. Also supraspinatus, sometimes subscapular, and even trapezius muscle can do that. So what I'm doing here, I'm just palpated, working on that area. And it's very gently, like I said, this is like not the case. You want to move a lot. And this is what you're doing here.
Yeah, I feel it.
Yeah, she feel it.
I feel it through a bunch of other areas. So I know where I'm like not supposed
Try to mobilize everything. Next one, I'm going to get a little bit mobility. Again, my left arm under that shoulder, right in that, where's that, the joint is. Now I grab that humeral bone, and what I'm doing here, I'm just start rotating. And I can go opposite way. I can go stick that humeral bone inside very gently and move around. Just get that little bit mobility. That's it. But trust me, the wall angel is going to be best exercise for her and best releasing technique. Again, I come back to this palpating in the beginning. I'm never put like in 120. If I can, yeah, it's fine. What I'm doing up here, I'm apply this to the pec muscle and apply slow pressure. Like I said, for the big guys, you can just go ahead right away. Use your elbow. And here, I'm gently. This is the one you can work single, rotate, ask her. Yeah, feel that? Good. I can work on subscapular, which is, do you feel tension? Where?
I just feel my shoulders coming forward more.
Exactly, but that's fine. The shoulder is coming forward.
The more I'm pushing back, the more that it wants to.
So give this client tell her do this every day. The idea is completely make that spine flat. We don't need to teach her to do this arms against the floor. Against the wall. And she should probably start on the floor because the gravity is going to help her. This is standing one is a little bit more, but that's fine. You see, but you start compensated here, and you feel that tension in there. Yeah. So she try to get this in the chest area, but the lower back and tense up. We don't want that. That's why. Remember, she's just like, hey, I got some problem up here. Why? Because this is the posture.